Hello, good morning to one and all. Myself Dr. Atul. I am welcoming you all to my YouTube channel Aradhana Ayur Blog AKN. So we will continue the section of anatomy, class number 3rd. We had dealt in the last class about regarding the bone called clavicle. So we will continue the remaining part in this video. So clavicle, also known as collar bones or the beauty bone. Please make this point also. It is also known as this one, and it is the long bone which lie horizontally. So all know this and this. So this is the horizontal axis, we can tell, and this is vertical. Okay. So in this, it is a long bone which is horizontally placed. It's a long bone which is horizontally placed. And in our body, the total number of bones which is present is 206. So 206 number of bones are there. In that horizontally placed long bone is the clavicle. And also this clavicle makes demarcation between the thorax region and the neck region. So it separates these two region, it separates this clavicle. Okay, so this just make this point which we had left in the previous video. And one more peculiarity of this bone is the first ossification. So you will see what then you will tell what is this ossification. The ossification is a process of formation of the bone. Okay. So that it starts, the first ossification starts in the bone called clavicle. That also in the 5th to 6th week of the intrauterine life. Next we want to know the location of the clavicle. Location of the clavicle, it is located at the root of the neck. And when we see regarding the number, it is 2 in number, both sides having one clavicle. And regarding its shape, it is, as we had drawn yesterday, it is S-shaped, we can tell. It extends from the sternoclavicular joint to the acromioclavicular joint. Yesterday we had told it makes two joints it makes, that is sternoclavicular joint and the acromioclavicular joint. So extend is from the sternoclavicular to acromioclavicular joint. When we see regarding the type of bone, which type of bone, when we see, it is a long bone. It is a long bone. So this was some of the point. So the first ossification, the formation of the bone or formation of that bony substance, when it becomes first formation of the bone, it starts from the clavicle. It is S-shaped and is a long bone, and also it is number 2 in number, and it is located in the root of the neck. When we see the applied anatomy, we had told that considering this as a clavicle, this is the sternum, and this is the medial 2/3 end, and this is the lateral 1/3. So this is the junction. Considering this is as a clavicle, just you imagine this as a clavicle bone and this is the sternum part. So this comes as a medial end, this is the lateral end. So medial 2/3 and lateral 1/3 where it meet, that is the junction. So this junction which we had talked, it is a weak point. It is a weak point, or generally there happens fracture. Fracture is occurring in that clavicle. Whenever fracture occur, the main or the weakest point of the clavicle, we can see this junction is the weak point of clavicle, weak point of the clavicle. So it is a junction, that is medial 2/3 and lateral 1/3 where it meet, that is a junction, and it is a weak point of that clavicle. So whenever the fracture happens in the medial 2/3 fracture, compression of the brachial plexus occur. Compression of brachial plexus occurs. Okay, so this were the some of the point which we had missed or which I had continued from the last class. So this is a junction where commonly the fractures occur. There is a junction between the medial 2/3 and the lateral 1/3. And next is a point is sex determination. How we can identify it is a male or it is a female clavicle. So the female clavicle is smooth compared to the male, and the first point is that one, and second point is the lateral end. I had told two end are there, medial end and lateral end. So the lateral end is lower than the male. So lateral end is lower than the medial end. When compared to medial end, the lateral end is lower when compared to the male clavicle. Okay, so these are the 2 points which you have to see. One is in female it will be smooth, surface will be smooth, and the lateral end will be lower than the medial end in case of the female. So these are the some of the point regarding the bone called clavicle.